Hi, my name is Kiara Hallows, and I'm interviewing Dr. Michael Bolognesi, and I have some questions for him. Okay, so to start out, why did you become interested in medicine and orthopedics?
Yeah, so for me, I first probably got interested in medicine in college, um, and I was playing football in college, and so we were around like the team doctors a lot, and so I thought I was interested in when I went to college I was interested in going into medicine to start with, but I think being around those team doctors sort of solidified that as something I was interested in. So I think that's where it started, I guess.
Um, what type of research do you do?
Right. So I basically just do hip and knee replacement, and so at our institution, the main thing we look at is, how people do after having those operations, hip and knee replacement. And most of our research is focused on, trying to optimize the outcome, like make sure the patient does really well, and then like do everything we can or figure out all the things that are predictive of a poor outcome so that we can avoid them. So I guess, we sort of group that as clinical research, but that's the main thing we're working
So to get out of it and basically to kind of like what you're hoping to learn from it
on. Right.
is to, in the future, how you can make surgeries better to
Mhm.
optimize what you're doing to make sure that no one gets has any complications
Right.
to try to make surgeries better in a sense.
No question, because these operations are like, for the most part, they're usually people do really well. Usually their pain's addressed. Usually they get through without a complication. So they're good operations. But our hope is that we, through the research we do, we can make them even better or more predictable and even safer, and because we're trying to make something that's really good even better.
With this research that you're doing, are there any standards that you kind of set that kind of guide this, like this research that you do?
Yeah, no, for sure. I mean, so we sort of, I think there's expected outcomes for these operations, and so, there are, scoring systems for how patients are doing and that sort of thing, and those are some things we track in research so that we can sort of confirm that we know the patient's doing well.
And what do you think your biggest contribution with this research has been?
I think we've done some things, primarily looking at trying to make, or maybe I should say, sort of optimize the patient's health before the surgery, such that we minimize or again decrease their risk of a complication. So we're trying to make sure that before a patient ever gets one of these operations, we've made sure there's nothing about their other medical issues or what we call their medical comorbidities that may be not again optimized, and therefore could put them at risk for a bad outcome. So I think we've done some great research to sort of show the things you got to work on or fix before you do the operations.
That sounds amazing. And finally, what are your thoughts on being in the field of medicine and being a surgeon, but also having the advantage of being a scientist and a researcher?
Well, I think it's, my thoughts are that it's, I'm really glad I'm in this position, because if you work in an academic institution like I do, that's, I think, one of the great upsides. This is not to be critical of someone in private practice by any means, but, one of the things we really, I guess, sort of treasure about our jobs is the ability to be working on these things, doing research. We sort of call, adding to the field and improving the field. Because I think if you're not in a setting like we are, you're probably not doing a lot of that. Now there's challenges, right? Because you have to do all this stuff while you're trying to have a, while you're trying to run your practice and still be a doctor and take care of all these patients. So it's like more work, and probably maybe in some ways a little harder. But I wouldn't do it any other way.
That sounds amazing. Well, thank you so much.
No problem.
It was a pleasure to interview you.
My pleasure.